Story 1. My name is Dr. Michael Richardson, and after years working in emergency medicine, this would be my last night. Retirement at my body and especially my mind couldn't handle seeing so much pain coming through those automatic doors anymore. It was a Thursday in March. Night shift from PM to AM. General Hospital was surprisingly quiet for a Thursday, which he considered a blessing. I wanted to end my career without carrying any more trauma. I was organizing some paperwork at the emergency desk when head nurse Patricia came to get me. Dr. Richardson, bay possible me. When I entered the bay, I almost stumbled. There was a man who looked exactly like me, just about years younger, hair still completely dark. No wrinkles around these without the small belly I developed. This younger me was leaning over a middle-aged man administering finifer. I blinked several times, thinking it was fatigue. When I looked again, there was only the patient on the gurney. Black male, about years old, sweating profusely with all the classic signs of acute myocardial infarction. It began the standard protocol. But something about the situation reminded me of Robert Williams, a carpenter I'd treated in same type of heart attack, same clinical presentation, same age. Back then, the difference was that Robert was white, had a scar on his chin, but the case was practically identical. I remember that day perfectly. I was a third-year resident, still insecure, still relied heavily on supervisors. I hesitated with the streptococcus dosage for Robert. Lost 5 precious minute test consulting protocols. We almost lost them. While preparing the medication for this new patient, I saw that figure again from the corner of my eye. My younger self was shaking his head, pointing at the clock on the wall as if saying, "Don't make the same mistake." I looked directly where he was standing. Nothing. This time, I didn't hesitate. Applied the medication at the right dosage at the right time. The patient responded well and was transferred stable to the ICU. 2 hours later, Patricia called me again. Bay child hit by car, severe head trauma. When he entered, he was there again. This time, it was me at hair starting to go gray at the temples, already with more confidence in my movements. He was adjusting in for drip, whispering something I couldn't understand. The child on the gurney was an 8-year-old boy. Blonde hair, very similar to Emma Thompson I treated in same type of accident, same age range, same pattern of cranial trauma. The difference waist at Emma was brunette and a girl, but the case was almost identical. Back then with Emma, I used an experimental Procoloc to reduce brain swelling. It wasn't standard yet, but it worked. She left without squelly. My year-old self looked directly at me, moved his lips slowly, as if reminding me of the specific mannitol dosage I'd used back then. I followed exactly what my younger version was indicating. The boy stabilized quickly. The night continued like this. Each patient who arrived reminded me of specific past cases, and always a version of myself from the corresponding era would appear. Sometimes younger, sometimes older, always related to those specific medical mores. The most disturbing happened at a 8-year-old girl arrived, brought by her parents. Accidental overdose of psychiatric medications. When I entered the bay, there were 3 versions of me. Me at newly graduated, still insecure. Me at the peak of experience. And me at already more tired, more skeptical. The case immediately reminded me of Tyler Johnson, a year-old boy. Same type of intoxication. Back then, I was too inexperienced, hesitated between 2 different antidotes. When I finally decided it was too late, Tyler died on way to the ICU. The 3 versions stared at me intently. The young one seemed desperate. gesturing toward the medications. The middle one was confident, pointing to a specific ring. The older one just looked at me with resignation. It was as if they were showing me all possible paths. The inexperience that killed Tyler, the competence that could have saved him, and the fatigue that sometimes made me give up too early. This time, I didn't hesitate for a second. I used everything I'd learned in years. The right dosage at the right time with the right technique. The teenager responded well to treatment. When I left the bay, the three figures had disappeared. Out of them, an elderly woman arrived with massive me. When I entered, my year-old self was there, but this time he was crying. I immediately married Mrs. Garcia. Back then, I managed to resuscitate Mrs. Garcia, but she was left with severe neurological sequelae. She spent years in a vegetative state until she died of pneumonia. The family never forgave me. They thought I should have let her go in peace. This new patient was the same age as Mrs. as Garcia had been. Same type of devastating heart attack. My younger self looked at me with tears in his eyes and shook his head. No, I was paralyzed. The woman in front of me was technically dead, but I could still try resuscitation. Would it be right to insist, knowing she might end up like Mrs. Garcia? I decided to try, but without overdoing it. 3 resuscitation attempts, standard medication, nothing experimental. If it didn't work, I'd let her go with dignity. It didn't work. The woman passed away at them. My younger self nodded as if saying, "Thank you for learning." At a.m., with minutes left in the shift, there were no more emergencies. I sat in the break room trying to process everything. Was I real extreme fatigue? Post-traumatic stress from 3 decades. Patricia offered with coffee. Dr. Richardson, are you okay? I noticed you were different today. Talking to yourself sometimes. Talking to myself. Yeah. In several bays. I saw you talking, gesturing as if someone was there. But when I got closer, it was just you and the patient. I didn't know what tones are. At them. Sharp. I took off me white coat for the last time. As I was walking down the corridor toward the exit, I looked back one last time. There he was. Me and on my first day as a medical resident, waving and smiling. I waved back and left. To this day, months later, I can't explain what happened that night. Maybe it was mind processing 3 decades of medical lessons, all the lessons learned from past mistakes and successes. Maybe it was just mental exhaustion. Or maybe in a place where so many lives cross between life and death, our past experiences take on a life of their own to guide us one last time. What I know is that night I applied everything I'd learned throughout my career. Each new case reminded me of an old case. Each decision was informed by decades of accumulated experience. And for the first time in years, I was able to retire at peace with my choices because I realized that each past mistake had become wisdom for the present. Each version of me, the insecure young man, the confident, experienced doctor, theater veteran, all contributed to the physician I became. And in the end, maybe, that's exactly how it should be. Story 2. I've been working in there for years and I've seen everything. Overdoses, car accidents, domestic violence, suicide attempts. You develop a kind of emotional armor. Otherwise you can't continue. But there are cases that stick with you that won't leave your head even years later. This was one of them. It was a Tuesday in September around when paramedics brought in a woman in her meds. Suicide attempt by medication, combination of benzodiazepines with alcohol, common pattern. Unfortunately, her name was Jennifer Walsh. Brown hair, thin with a cut on her left wrist that looked more like a cry for help than an actual attempt to harm herself. We did gastric lavage, eye fluids, the whole standard protocol. She was semi-conscious when she arrived, but responsive to stimuli. When she fully woke up about hours later, the first thing she said was, "Strange. Why are you still trying? I'm already dead." I figured it was mental confusion, residual effect from the medications. "Jennifer, you're in the hospital. You relive and safe." She looked at me with an expression I'll never forget. It wasn't despair. It wasn't sadness. It was absolute certainty, almost serene. "Doctor, I know you're doing your job, but I died at home." My heart stopped. I saw everything from above. The paramedics resuscitating me. You guys here at the hospital. My body just hasn't realized it yet. But I'm not here anymore. I explained that these were normal hallucinations and overdose cases that the brain sometimes creates these experiences. She shook her head. "It's not a hallucination. I don't need food. I don't feel thirsty. I don't feel pain. Look." She pinched her own arm hard. Didn't show any reaction. I tested hair reflexes. They were normal. Vital signs stable. Blood tests showed the medications were already being metabolized. Physically, she was recovering well. But Jennifer refused to eat, to drink water, to cooperate with any treatment. Not out of rebellion or depression. She was polite, even kind. She simply said, "I don't need that. It's over. I'm just waiting for you to notice." The psychiatrist, Dr. Stevens, evaluated her, said it was a complex defense mechanism, extreme dissociation. He prescribed psychiatric medication and recommended admission for observation. Jennifer took the meds without complaining, but kept repeating, "You can give me whatever you want. It won't make a difference." On the second day, something was bothering me. She hadn't used the bathroom once. When I questioned her, she said, "Dead bodies didn't do that." "Doctor, I ordered new tests. Everything normal. But there was a me thing about her body temperature. It was consistently below normal. Not hypothermia, but constantly low." On the third day, she asked to speak with me. She was lying down, staring at the ceiling. "Doctor, thank you for trying. You're a good doctor. But today it's going to end for real. You won't be able to bring me back this time, Jennifer. You're not going to die. Your tests are normal. My time here has passed. I just wanted to thank you for leaving permanently at a.m. Jennifer had sudden cardiac arrest. Complete assist. The heart simply stopped beating. No prior arrhythmia. No warning signs. We tried resuscitation for minutes. Epinephrine, atropine, chest compressions, defibrillation. Nothing. It was as if the heart had decided to stop and didn't want to function anymore. The autopsy found no cause of death. Healthy heart. No signs of cardiac disease. Medication levels in the blood were already almost undetectable. Technically, she shouldn't have died. Dr. Stevens said it was coincidence that the suicide was part of a severe depressive episode, and that shedded from complications we called intellect. Maybe, but I keep thinking of other words. My body just hasn't realized it yet. And the consistently low temperature, and the fact that during the days she was admitted, the hospital security cameras malfunctioned sporadically in the corridor, where her room was only during her stay. After she died, everything went back to normal. Maybe it really was just coincidence. Maybe my mind is creating connections where none exist. But sometimes I wonder, what if Jennifer really knew something we don't? What if there's some moment between Life and death that medicine still can't explain. I'll never be certain. I just know that since then, when someone arrives here after a suicide attempt, I pay more attention to what they say. Not just the physical symptoms, but the words. Because maybe, just maybe, some people know things that we doctors are still learning. The strangest part came about a week after Jennifer died. I was reviewing her case file when I noticed something I'd missed before. Her admission time was logged as PM, but according to the paramedic report, they declared her dead at the scene 8 p.m. and worked on her 4 minutes before getting a pulse back, meaning Jennifer was clinically dead 4 minutes before they brought her back. Minutes where, according to her, she watched everything from above. I led the paramedic unit to confirm. Jake Morrison, veteran paramedic with years' experience, was part of the crew that day. Yeah, I remember that call. He said when I reached him. Strangest thing. We worked on her for what felt like forever. She was complete a lifeline when we got there. Usually after that long, even if we get them back, there's brain damage. But she came back, perfectly lucid. Did she say anything when she regained consciousness? That's the weird part, Doc. First thing she said was, "Thank you for trying, but it's too late." Not, "Where am I?" or "What happened?" Like most people, it was like she knew exactly what had happened and was, "I don't know," resigned to it. I hung up, feeling more unsettled than before. There was something else that bothered me. During those 3 days Jennifer was with us, several staff members mentioned feeling unusually cold when they entered her room. The thermostat showed normal temperature, but everyone complained about it being chilly in there. Nurse Bradley, who'd been working our unit for years, pulled me aside on Jennifer's second day. "Dr. Peterson, there's something off about room. I've been getting goosebumps every time I go in there. And he is sturdy. I swear the monitors were showing a heartbeat for about seconds after I unplugged them for cleaning. He checked it up to old equipment and nerves. But now I'm not so sure." The night Jennifer died, I was making rounds when I passed her room around a.m. Through the small window in the door, I could see her lying there. But for just a moment, it looked like there were 2 figures. Jennifer on the bed and Samian standing beside it looking down at her. I blinked and opened the door immediately. Just Jennifer lying peacefully staring at the ceiling. "Are you all right? Do you need anything?" She turned her head toward me with that Samusarian expression. "He's here to take me home, doctor. Thank you for everything." "Who's here?" "Jennifer." But she'd already closed her eyes. Minutes later, her heart stopped. I've never reported the things I saw and felt during those days. Who would believe it? But I can't shake the feeling that Jennifer Walsh knew something the rest of us don't. Maybe death isn't as final as we think. Maybe sometimes there's a window, a pause, where the spirit lingers while the body catches up. Or maybe I've been working too many night shifts and my mind is playing tricks on me. But when I think about Jennifer's words, "I'm just waiting for you to notice," I wonder if she wasn't waiting for us to notice she was dead. Maybe she was waiting for us to notice that sometimes death is just a transition we don't understand. Yet, I still work the samer, still see suicide attempts regularly. But now I listen more carefully to what patients tell me, especially the ones who seem to calm, too certain about things they shouldn't know. Because Jennifer Walsh taught me that sometimes the most important diagnosis isn't written in any medical textbook. Sometimes it's written in the space between heartbeats, in that pause between breath and silence, in that moment when the body realizes what the soul already knows. And maybe that's a kind of medicine, too.